developments in the COVID-19 situation, some details on what actions organizations are taking and what resources are available to NGOs. We'll share with you some medical advice and guidelines, and then we'll answer the most frequently asked questions, which we have been receiving in the past few weeks, actually. And there will be a possibility through the chat to send us some additional questions. Now, just as many of the organizations or corporate environments, Cigna has taken some additional actions when the COVID-19 pandemic actually started. We decided to increase our coverage for the COVID-19 testing, office visits, and in-network treatments. We have set up a 24/7 toll-free support line. We rolled out even more and quicker our telehealth and EIP support. And we have shared a lot of communications, both to clients, members, brokers, but also to our staff, actually, for our Cigna employees to really understand what is COVID-19, how to take care of themselves and their family, how to stay safe, and how to shift from working in an office to working from home. That's also why we have set up our BCP plan, just as many other organizations, I guess. So that's in a nutshell, very quickly actually, what Cigna, what we have done. And I think now I'll give the word to Peter. He will introduce himself and run you through some of the scientific things about COVID-19. Peter, over to you.
Thank you very much, Inga. Good afternoon, everybody. Thank you very much for taking the time to listen to this presentation. My name is Peter Mills. I am one of Cigna's European medical directors. I'm also a respiratory doctor by trade. I still work 1 day a week in London for the NHS. So we're certainly seeing a busy time. I've also got a background in infectious diseases as well. So like Inga, I've been following this global pandemic very closely. Can we move on to the next slide? So the focus today is really going to be on the medical, clinical aspects of the COVID-19 pandemic. We can, to a certain extent, answer some coverage questions as they apply to Cigna. But again, as Mike said, if there are any questions that fall outside of this more clinical remit, they can take those offline. You, over the last couple of months, will undoubtedly have read a lot about coronaviruses, and particularly the current coronavirus that causes COVID-19. The naming of this virus is actually SARS-CoV-2, and that is because there are a number of coronaviruses that we know of. Many of the common colds that we get in the winter months are coronaviruses. And we also have known for a long time that coronaviruses can cause diseases in other animals as well, particularly livestock, cows and pigs. Farmers have quite a lot of problems with coronavirus diseases in those animals. The reason it's called a coronavirus is because of what it looks like, and you see a picture there on the screen with these little spikes sticking out of this ball, and it was named a coronavirus because it looks like a crown. It looks like a crown sitting on someone's head, this particular coronavirus was first discovered back in December of last year. In reality, it was probably circulating within the population, within the Wuhan, Hubei district population, probably for a couple of months before that. And what they started to discover was a severe pneumonia in a number of people in this region, which led some of the doctors there to suggest that this is actually a new infective agent. Initially, they thought this could potentially be flu or another flu-like virus, but when they did the tests, they didn't discover the influenza virus at all. And it took a little bit of time to work out that actually this was a completely new virus that we had no tests for. With some quite advanced lab-based analysis, they found out, okay, this is a coronavirus, but this is a coronavirus that we've never seen before. The characteristics, as you've probably all heard, of people who get infection with this virus are cough, fever, shortness of breath. Also, we can add to that muscle aches. Some people actually do get symptoms that are very suggestive of a cold, runny nose, itchy eyes. But the common symptoms are cough, fever, shortness of breath, and general muscle aches and headaches and the like. It took a little bit of time, but public health laboratories around the world are able now to test for this new virus, this SARS-CoV-2 virus. It's quite a complicated test in that it requires genetic analysis and something called PCR, the polymerase chain reaction, to amplify the DNA that you can generate from this virus. There's no vaccine as yet, as you know, but there are a number of countries, including the United States, including some European countries and the UK, where I believe many of you are currently based. There's no vaccine as yet, but a number of countries are working on this. It's not a simple task to create a vaccine, especially a vaccine to a new virus like this. And traditional vaccine methodology that is used for the creation of the flu vaccine on an annual basis doesn't work because we cannot get this virus to grow in eggs, which is the primary method for creating the flu vaccine on an annual basis. You'll hear a lot about treatments. You'll hear some of the comments coming out of the United States about different treatments. We will touch on those during the questions. But really, at the moment, the only management for individuals who have severe infection with this coronavirus, who have COVID-19, are supportive treatments, oxygen, drugs to actually bring down people's temperature, IV fluids, and if needed, support for them in terms of ventilation to help their lungs work. These are viruses, so therefore antibiotics don't work, but in certain situations you do also need to give people antibiotics because they develop a secondary infection with a bacterium. Can we go on to the next slide, please? On a daily basis, we are getting updates of affected countries, affected regions, both the number of individuals within these different regions that are testing positive for the virus and are being admitted to hospital with the COVID-19 disease. But also we're getting updates on the mortality and the death rate from this condition, from this viral infection. And it's true to say that really without very much exception, pretty much every single country in the world has now been affected by this virus and by the viral spread. Hence, it's called a pandemic. It's a rapid spread of an infectious agent that is occurring independently in multiple regions around the world. That's the definition of a pandemic. There are many good websites to have a look at the data that is being updated on a daily basis. Of the pandemic within our country, within our location. For those of you who are outside of the UK, again, you can get your you can get your data for your particular region very easily from these websites. Can we go on to the next slide? As I mentioned, variable symptoms for people who do get infected with the coronavirus and who do have COVID-19. As I said, fever is the most common. Pretty much everyone gets a fever of some sort who's got significant disease. So disease that's bad enough to warrant testing, to warrant accessing healthcare resources and getting healthcare advice. Dry cough is another very common symptom, as is fatigue. We then start to get into the realms of symptoms that are actually less than 50% of people have. Some people have reported sputum production, as in with a regular cough or cold. Shortness of breath, about 1 in 5 people report shortness of breath, muscle and joint pains, headaches, and sore throats. But I think one of the things that really should be emphasized, and a lot of the media attention has been on the severe end of this disease, of this infectious agent, is that still the overwhelming majority of people have relatively mild disease, and they have some of these symptoms, but they don't require medical attention or medical intervention. The average or the middle in terms of the incubation period, so from when you are exposed to the virus to actually when you first start showing symptoms, is about 5 days. But as with all types of illness like this, there's a big variation across the board. Some people are less, some people are more. The majority of people will exhibit symptoms within 11 or 12 days. Very, very rarely are people taking longer than that. It has been described, but for the majority of people, that's going to be less than 11 days and probably around the 4 or 5 day mark after exposure. Next slide, please. Again, you've probably heard a lot about the death rate from COVID-19 and the fact that those individuals who are elderly or have pre-existing conditions are more susceptible or more likely to get severe disease and more likely to die. This slide here just shows the mortality, the case fatality rate based upon age group. And as you see, those people under the age of 60, and certainly those people under the age of 50, the mortality rate, although it is appreciable, it is not very high. You know, the majority of people in these age groups will not have severe disease. If they do get severe disease, they are likely to recover. it's really as you start to get into the older population that you see a greater susceptibility to the virus and to the impact that it can have on them. If you look at 80-year-olds, 15% of individuals who are over 80 who do contract the virus, who do get COVID-19, will sadly die. However, having said that, if you flip that on its head, you also can say, well, 85% of people who over the age of 80 who get this won't die. It's not as bad as it is as bad, but it's really a question of how you look at numbers sometimes, and sometimes the media do tend to focus in on the negative side of things. Move on to the next slide, please. You'll have all seen this. You'll have all heard the expression now that has become a mantra for public health systems around the world about flattening the curve. This really just illustrates it and reinforces it. And the reason that we are trying to get people to socially distance, to isolate themselves from other people as much as possible, is so that rather than overwhelming our healthcare system with a whole load of people all getting severe illness all at the same time, therefore completely drowning the ability of our healthcare systems to manage them, what we're trying to do is spread that out over a longer period of time, not overwhelm our healthcare system. Therefore, trying to improve outcomes from the condition, especially those individuals who have severe disease, and also reduce the total number, the total burden. And to a greater or lesser extent, depending upon the location, the country that individuals are in, some countries have done a better job than others. And I think it has certainly highlighted areas of our healthcare systems around the world that we can learn from and that we can improve in the future. Let's move on to the next slide. I'm going to hand over now to Inga to just go through some of the preventive measures and some of the things that you, as an employer of individuals around the world, can think about doing for your employees, for your co-workers.
Yeah, thank you, Peter. I think Peter already pointed it out. There is no real treatment. So as physicians, we are really back to supportive treatment. That's also why I think all governments and the World Health Organizations are pushing so strong on all these preventative measures, because it's really those measures that can assist us in the spread or the stopping of the spread of this epidemic. It's a basic hand hygiene, I think, frequent hand washing, but when we say hand washing, it doesn't mean the quick hand washing. It's really thorough hand washing. Some people say you have to sing a song, you have to sing happy birthday twice, for example, is some of the recommendations we have been told. It's also your cough etiquette. It sounds logic, but it doesn't always happen. It's when you cough, when you sneeze, it's to cover your mouth. By preference, if you have nothing else than your hands afterwards, you should wash your hands. That's also why the recommendation is cough in your elbow, because a lot of transmission is actually happening through the hands and the handshakes that people were having with people who are carrying the virus. So avoid handshakes, avoid close contacts with people suffering from acute respiratory infections. We are actually at that stage that Also, WHO is saying everybody who has signs of symptoms of an acute respiratory infection, regardless if they have COVID-19 because or not, because many people are not being tested at this moment. Just keep your social distance. So stay home when you're sick. It looks also basic, but still people were going to work or were taking public transport or the crowded local public transports that we have in some of the sub-Saharan countries. So when you are sick, please stay home. Clean, disinfect frequently. It's not the main way of transmitting the disease, but when you cough, when you sneeze, there are droplets that could stay on some of the surfaces. When you open the door, you from your hand it's going to the handle of the door. So again, in many of the healthcare providers or even some other public facilities, that's what people are now doing, really cleaning the handles of the door to make sure that they don't get it by coincidence. And then the other important thing is the social distancing. We have all been told, keep distance, keep 1.5 meters, which I think is 6 feet or 3 feet. I'm not sure, sorry for that. It's really to avoid large crowds, to avoid people standing too close, next to each other, so that these droplets can spread. A human being is a social we are social out of nature, so we like being with friends, we like shaking hands, we like giving hugs, and all this is now put to a stop or to a limit. So it's really difficult for us as humans to take that step back and to avoid shaking hands, which are the basic way of greeting people, or to keep that social distancing and to keep to your family only. You would be surprised how often in a day after you have touched something or you were moving around some things or you were shaking a hand, how often then you put your hand on your face, as the picture is showing, somebody taking off his glasses and just rubbing in his eye. That's also a way of spreading the virus, and that's why washing your hands is just a basic thing that all of us, we have to do throughout the day, basically. Of course, all these preventative measures and the social distancing, it leads to stress. As I say, people are social. We want to see our family, our friends, our grandparents. And now suddenly in many of the countries, and there are more and more countries where actually the confinement at home is imposed by governments, you find yourself spending quite some extensive time at home with your wife, with your children. So it creates conflicts. You have to talk openly to your family. You have to find ways to still enjoy the little things of life, to try to get some sunshine. Not always easy. I spoke to my colleague this morning who is in Madrid, and they cannot leave the house unless they are going for some grocery shopping. For the rest of the time, they need to stay at home. Fortunately, nowadays, we have the phone, we have the computer, so use it. Talk to your friends, talk to your colleagues. Get this social interaction going. But then, of course, you have the social media pitfalls, because we are at home, we have time to read. There is a lot of information on the social media. There's a lot of information on the internet in general. Some are trustworthy, other ones are less. I did read people thinking that the 5G spread is making the spread of the coronavirus happening. Be careful what you read. That's also why we put WHO, World Health Organization. I think they have always the latest information. You can rely on what is shared on their websites, because there is a lot of other information out there. And the stress of being confined, together with maybe not be able to walk freely or to do what you want, is really giving people a lot of stress, a lot of mental health. Don't be shy to ask for help. I think it's normal. We all go through it, and we all have to go through it together, basically. So as I say, for more information, please go to the WHO website. They spend daily updates. There's also a lot of information you could use within your organization to share with your employees, to give them the accurate and the most up-to-date information, that you can either print or forward by email so that people can read it, basically. This was the end of our presentation. We've come to the frequently asked questions, where, as I said in the beginning, we take most of the questions we have been receiving in the past few weeks. We have put them in 2 slides, and we'll try to answer all of them. There will be the possibility to share through chat some additional questions with Peter, who will at the end try to tackle some of them, and we will be sharing some information and additional answers to the questions we received in the coming few days.
Thank you. Yes, we've had one question through on the chat, which is the data on mortality. Is that UK data or is that global data? So this is global data. There's some good sources and data dashboards out there that analyze all of the reported cases of COVID, all of the death data from COVID as well. So that's a global view. Different countries are slightly different in terms of the mix, if you like, but generally speaking, that slide that I showed on mortality holds true across the globe. Certainly the original data from China, the data we're now getting from Europe and the United States all supports this marked difference in mortality based on pre-existing conditions, but also on age. So the first question here: Are there any somewhat reliable estimates of how long this will last for? And this is really the $1 million question, isn't it? And I think there are so many different theories and so many different opinions on this. Certainly speaking, as a respiratory physician, we do see seasonal variations in respiratory pathogens, in infective agents that cause respiratory disease. The flu, other coronaviruses, rhinoviruses, etc., all show a seasonality. And so our hope, anyway, is that that this virus is going to show the same sort of seasonal variation, where it drops down, the level of infection within society, within populations, drops down during the summer, warmer months, and will allow us, hopefully, to get back to a degree of normal living, a degree of normality, but also provide us with time, provide the scientists and the scientific community with time to research further, look at potential treatments, and advance the development of a vaccine. If it does occur, I think it is likely that it will in the winter, colder months across the world. And as the southern hemisphere goes into its winter, it may well be that they get more cases during that time as well. But really, no one really knows about this. So we have a question on expat and local staff covered by private COVID testing. I'll get Inga to answer that question.
Yeah. So of course, please take into consideration that the information we share is of course what Cigna is doing. We are here first place as physician, secondly as what Cigna is doing. I think the best, if you're not insured with us, is really to check with your own health insurance and see what is their coverage for COVID-19 testing. Now in our case, as long as they are covered by Cigna, we do cover for testing. As Peter pointed out, we really talk about the PCR testing. There are a lot of other tests coming into the market. Some of them are not even going through proper qualification. They have not shown good results, but unfortunately people are bringing out a lot of rapid testing into the market. So our recommendation is really to go to the identified providers, and there for your swab, it's an oral or a nasal swab to be taken and then sent to the laboratory for the PCR testing. I think it's important to point out that for us it does not matter if it's public or private, as long as it follows the local recommendations for testing, and then indeed we can cover the PCR testing. Mm-hmm.
Thank you, Inga. Yes, there are a number of tests and labs popping up suggesting that they can provide you with a COVID-19 test for the bargain sum of €350 or something like that. So undoubtedly, this is seeing opportunistic practitioners coming into the marketplace with tests that haven't been validated, that haven't been approved. You know, I think it really is important to be mindful of that. But as Inga said, we will cover any approved test that is recommended by a physician for our individual covered members. The next question: how can international NGOs not usually involved in acute humanitarian pandemic control repurpose their resources to add value? I think really for this question, I'm going to ask Mike from Bond to give a response, because I think this is outside of certainly my area of expertise.
Yeah, I mean, that's a very interesting question, and one we're currently addressing with DFID in terms of the way it's offering flexibility within its programs. I think we've got a bit more work to do with them at a sort of higher level. They've endorsed the idea that there should be a degree of program flex and using resources that were had specific program outcomes associated with them and flexing them towards a COVID response. But that's not what we're finding is that that's not filtering down to the SRO level, so the reporting, the people that if you've got a grant or a contract you report to within DFID. So I think a bit more work for us to do on that. I think DFID are shaping up to allow that flexibility, and certainly other funders other than DFID are offering a great deal of flexibility. So the institutions and institutional funders and donors are, other than government donors, are doing a better job at being flexible. But we'll speak to that a bit more in other places on our website as well.
Thanks, Mike. The next question is, could you give mental health advice for people in isolation? And I think this is a great question. Inga touched a little bit on putting in place strategies for isolation for individuals who maybe are not actually on their own, but with members of their family for protracted periods of time, when maybe not used to spending that amount of time with our family members. But also there is that real issue of individuals who are on their own, and the impact that can have on one's mental health. One of the things I think is really important for any employers is to regularly communicate with the people within their business. And this is really not just about email communications, it's about picking up that phone, talking to people, we've now got these great video conferencing capabilities, and we're using Zoom here. People are meeting up, if you like, virtually to have conversations and communications. With my elderly mother, I'm phoning her at least twice a day on FaceTime. So I think it's that making sure people still feel connected with each other, with their workplace, and utilizing the technology that we have at our fingertips to enable that. I think also putting in place services that people can use if they really do feel that they're suffering from the prolonged isolation, from the prolonged uncertainty that this can also bring. EAP services, we've already mentioned. Many organizations have international EAP services in place for their employees, for their workers. Also, we are talking a little bit about telehealth as well. And telehealth has been absolutely marvelous during this pandemic, helping people get medical advice, medical reassurance or guidance without having to leave their home, their place of safety, having that video or telephone consultation with a doctor that can help them work through both their COVID-related issues, do I have COVID, do I need to get a test, where can I get a test, but also non-COVID related issues as well, which we know don't go away, and they may also be playing on people's minds. And then finally, just psychological interventions anyway, from psychotherapists, from psychologists, that can help people work through this. At Cigna, we were very keen that we made sure that we covered those interventions, those remote therapy sessions that individuals can have, because we also know that speaking to someone in your own language, from your own culture, especially when mental health is concerned, is really, really important. So they are things that certainly we've made sure that we have available to our members, to our insured lives. Could you advise on the medical evacuation for international staff who have contracted COVID-19? Okay, this is my area again as well. I run the evacuation repatriation service for Cigna, certainly from the clinical operations side of things. And without a doubt, this has proven really challenging to us over the last few weeks. We have people with COVID-19 in some really quite remote areas around the world. And it is requiring a lot of time, a lot of negotiation with government authorities, both in terms of where an individual is, and getting their okay from the government in that country to move someone, but also and perhaps even more difficult is actually finding somewhere for that individual to go, to get a receiving country and a receiving center for that individual. So it can be done. It is very, very, very difficult to do, but we have moved some people usually back to their country of citizenship. So what we're finding is often it's difficult to move someone from a less developed area to the nearest country where we'd be happy with the medical care. It's difficult doing that, but what we're finding is that we can usually negotiate better with their country of citizenship. So if you were, say, a French national, getting you from West Africa to France is potentially the route that we do these things. My advice really is that if you do have staff in remote locations, if you do have staff that think they are getting on well with the COVID virus, then to contact us early so that we can really start to work with our emergency assistance providers as early as possible to try and put a plan in place. It really, really is difficult if you've got someone who's very sick and you're called about them to get the wheels in motion, in the amount of time that it takes. So early advice to us as the insurer is something that we ask for. Okay, we've got, what extra precautions should we take for frontline workers engaging with people we serve in lower to middle income countries where social distancing is challenging? What extra precautions should we take? That's a difficult question, actually. I'm going to hand that over to Inga because she's the queen of the difficult questions.
It is a very challenging question. I think we've seen some of the media coverage on some of the countries, what's happening, because people are living in difficult conditions, very often in slum area. If we talk about less developed world where they are packed onto each other. I did see also some hopeful things, like in Kenya. I've known that some additional hand washing points were set up by people locally. Of course, your local community or your government plays a very important role there, same as community health workers. I think open communication, clear communication also is something where you as organizations who are very often working in some of those neighborhoods could assist in. And then I tie it a bit into the mask, because that's also a question that we received. Is wearing a mask effective? Homemade masks. There are a lot of discussions going on, countries who decide differently. I think it's up to each organization, each government to look into the potential benefits. From the World Health Organization, they clearly say you wear a mask if you're sick, if you have to care for sick people. But they also say if you're coughing or sneezing, you should wear a mask. And there is where there's a little bit of a gray area, because we know that before people really get symptoms, there is the possibility that they are spreading the virus by coincidence sneezing once. So wearing a mask is more to protect other people. The chance that you then infect them is lower. So it could be one of the actions we can take, but it can never be a single action. It always has to go together with all the other preventative actions that we discussed about earlier on. And I think talking about difficult situation, I think the only thing we can do and the best we can do is communicating clearly, as we do for other infectious diseases. Thinking about Ebola, we also had to go through a lot of communication and stigma in some of the communities. but I think we still have to communicate and share our information together with all the tools that we have as organizations.
Excellent, thank you. Okay, I'm going to come to the questions that are being sent through in a minute. How can we effectively identify staff who have been struggling with these changes when we're all working remotely? I think this is really the challenge for all lines of business, there are certainly significant groups of individuals who are not used to working remotely, so they're having to get used to a new way of working, a new way of doing things, but also with that increased isolation or decrease in person-to-person communication and contact. Again, I think it's really about communication, communicating with your direct reports, really going that extra yard, that extra step in terms of speaking with people, trying to re-establish those connections that are very easy when you're working in an office environment, a face-to-face environment, even in the field where you're seeing people on a daily basis, to really try and establish that. Just really speaking personally from my own perspective, it's about using that technology. It's about using the video calling that we have to speak with your children, speak with your direct reports, with your boss, and with your family. But I think it's something that we're all going to have to work through and again utilize the resources that are available either through Cigna or some of the other resources that are available through some of the large non-governmental organizations to really help people with their mental health. Let's get to one of the questions. Okay, we've really talked about how we protect our program staff from risks to health when responding to communities in high-risk locations. We kind of covered that one off already. There is a question here that is similar to the social distancing question. In low resource settings where water is limited, especially with summer setting in, are there any suggestions for alternatives? I'm going to give that one to Mike because I'm not really au fait with what can be done where water is limited, and how can we help individuals within these situations.
Yeah, I'm not sure about that either. I think if we can bank that question, and if we know who the person posing the question is, we'll try and get back to you directly after the session. I'm really not sure on that one.
Yeah, okay, that sounds
maybe quickly add, I think it's hand washing. I stressed a lot on it, but also avoiding handshakes, and that is something that even in areas where you have I know where the water is very scarce. I think keeping a distance and then avoid handshaking, even if it might be perceived as not very respectful if you don't shake the hands of the people. But again, coming back on, then we need to communicate, and sometimes we might need to go back to the basic communication. As I know in some of the communities in less developed parts of the countries you work in, the correct messaging on COVID and the virus might not have spread as well as in the more developed cities in the countries. So I think that's part of the answer. It doesn't solve everything, but it can be part of the answer.
Thanks, Inga. Yeah, I think that's definitely the case. There's a question here. Could you advise on the setup of the EAP telehealth service? I'm going to get Inga to answer that because she works more closely with the international organization Book of Business for Cigna.
Yeah, so that's maybe from our side. I think that's more for you to get in touch, at least for Cigna to get in touch with your client manager, I would say, and then see how we can collaborate to set up as quickly as necessary. We have the programs in place, the tools are there. Not everybody might have access to it. For the ones who are not insured by Cigna, I'm sure you can contact your current health insurance. And maybe Mike, I don't know if you have something more to add from your side to this. I think it depends probably of every organization and their health insurance and who they work with.
Yeah, exactly. I don't think I've got anything to say in addition to you, Inga.
And I think, you know, one of the things that as this drags on, and I think as this is, you know, going to be, you know, it's not going to be gone anytime soon, or if it does die down, I think, you know, we'll get a second wave towards the end of the year. These are areas I think as an employer you should really think about in terms of how, if you haven't got them already, you know, think very hard about putting them in place for your workers, for your people. We've found it to be a tremendous service for people, especially those in remote areas.
Mm-hmm.
We're coming up to the top of the hour. There's a question on travel ban. Basically, there's a worldwide travel ban. Under what circumstances would travel be allowed? It's difficult to know really on the travel side of things. I think we are going to start to see some of these travel restrictions lifted as countries start to try and move towards getting back to some level of normality over the coming weeks. I think some of these travel restrictions are going to be lifted, but ultimately that's up to nation governments to decide. I think we're good. I think we've got 2 minutes left. So I'd just like to take this opportunity to thank you for your attention, for spending time with us this afternoon or this evening, whatever the time is for you. We, as I said, we'll be happy to collate any questions that haven't been answered, put them into a document, and circulate them amongst the participants.
And I'd just like to thank Peter and Inga and Cigna Health Insurance for providing this advice. I mean, as always, if you're, you know, these are tricky times. We at Bond are dedicated to, you know, giving you some of the answers to the questions that you've got. Please keep contacting us. The more you tell us about what you need, the more we can provide for you. And, you know, look out for other seminars like this one. And thanks again to Peter and Inga for this one. Much appreciated. And thank you for all attending. Thanks a lot.
Welcome. Thank you very much.